Hi, I am Ash and I am living with HS. So I was very active as a child. I played a lot of sports and I noticed I would get bumps in my armpits, especially after practice or a game. And they wouldn't go away. It wasn't like a pimple, just it was painful and it wouldn't go away. And so at a pediatrician appointment, my mom brought it up and we discussed, hygiene and making sure that I was washing properly and, um, that I was always being encouraged to lose weight, even though I was very active and very healthy, other than my weight. Um, so throughout the years, it started getting progressively more aggressive in the armpit area and then under my breast area. Um, same same solutions from every doctor. Oh, it's a hygiene issue. Oh, you're overweight. This wouldn't be happening if you weighed less. Um, and so it started probably when I was about 12 or 13 and progressed from there. So first thing that I noticed that really impacted my quality of life is I don't feel like I sweat the same as someone who doesn't have HS. And so when I would get outside in the summer, especially, I would get very overheated very quickly. If I'm in a hot tub, I'm overheated extremely quickly. So I found myself kind of limiting my activities sometimes just because of how my body reacted in those instances. Um, it was something that it was very embarrassing for me. I didn't know, first of all, what my body was doing and why, and then to be told by physicians that I was basically dirty and fat. It's just really embarrassing. You think that there's something wrong with you and what you're doing, that you're incapable of taking good care of yourself. Um, and dating was very difficult. I always felt the need to preface any kind of sexual activity with a partner with, this is not an STD, it's not an STI, this is, something else. This is a dermatology issue. Like even though I didn't have a name for it, like I would have to reassure people like it's just a skin condition, it's nothing contagious. And that's also, very vulnerable and humbling experience when you're trying to be intimate with someone. um so yeah, those types of things were really difficult for me. um as the disease progressed, it would eventually leave. Like I don't have issues with my armpits anymore. It's more located in my groin area. And so now we start getting into the territory of bathing suits and, walking long distances when your skin is creating friction. And so again, this mental planning and preparation anytime I want to do activities that are seemingly normal for other people. And it's difficult, I think, because for most people with HS, and I know not everyone, but for a lot of folks with HS, it's more invisible to other people. It's covered by clothing. And so people just assume that we are able-bodied and then, kind of ask questions or poke fun in kind of really easy ways of, gosh, what, why aren't you able to do these things? And then you have to be outed as a disabled person. So yeah, those are some of the challenges I think that I've experienced in that time. I have been clinically diagnosed with depression and anxiety. I also have another mental health diagnosis, kind of separate from those things. I have borderline personality disorder as well. And so that combination, I feel like it's a constant cycle, actually, of me being like, oh my gosh, I feel like I have to be hyper aware of my body, hyper aware of how I'm presenting myself. And then, with the borderline personality disorder, I'm constantly trying to figure out, like, oh my gosh, did they see any of my sites? Like, are they judging me? And how is that going to impact me? Do they still like me? So it's a constant filter of people's judgments on me. Um, and yeah, like that causes me to stay home. Um, I get myself really worked up and have to kind of de-escalate myself into just thinking like this is all pressure that you're putting on yourself. And you wouldn't necessarily feel any of these things if you didn't have this disease. So um yeah, just learning to work through all of the flurry of guilt and questioning um, and embarrassment and shame that comes along with it can be exhausting. And then there's the fatigue that comes from all of that and the physical symptoms. Like you're just exhausted at the end of the day from managing it all. As things progressed as the symptoms progressed into my groin area, and I was having like consistently open wounds that wouldn't close, it was just so painful, and my clothes were getting ruined. I was just in misery, and I knew that something was wrong. Like I was doing all of the things that I was eating better and the exercising that they told me to do was excruciating and actually made my flares worse. So I was doing all of these things that they were telling me to do with no relief. And I happened to be working in continuing medical education at the time. I was an educational planner with access and knowledge to go into go into medical journals and research some of the symptoms that I was having. And I started coming across this Hidradenitis Suppurativa. I couldn't even pronounce it. And I was just like, yes, yes, like every single symptom that was there. And some of the articles even went through the frustrations that patients had with misdiagnosis or no diagnosis. And I was just convinced that this was me. Um, and so I went in, I was at the time, like I said, working kind of at the medical school. So I had entrusted my care in the primary care clinic there on campus. And I showed up with a stack of journal articles from JAMA and New England Journal of Medicine and all of these journal articles that were about HS. And I said, I think I have this. And this lovely resident whose father happened to have been a dermatologist said, I think you do too. And so we started down this path of like, okay, now we know what it is. What do we do with treatment? And I think I started with really heavy antibiotics, things like rivampin, clindamycin, um, what were some of the doxycycline, whew. Yeah, just all of these things that were just so hardcore. I was still researching treatment now that I had a name for it, and, came across biologics, would still come across doctors on that journey that were like, "Oh, honey, that medication is for people with rheumatoid arthritis or Crohn's," or, they weren't aware. People in medicine were not aware enough of this disease to understand how it was to be treated. And so even after my diagnosis, I feel like I've been on another journey with the treatment side of things. So I think I forgot to mention I was 32 when I
Mhm.
finally received a diagnosis, and I think I burst into tears at the doctor's appointment. I think when he validated and said, "I think that's what you have too," it was just so much of a relief. Um, yeah, I mean, it allowed me to kind of process things a little bit and I'm a very research-minded person, so it allowed me to start researching it and kind of, well, I wouldn't say understand it because it's a very complex disease, but start this path of learning more about it so that it's not this scary, unknown thing. Um, I feel like I'm more empowered now that I can understand that it happens to so many other people, that it's not a case of bad hygiene or my weight. Um, yeah, and just to be able to start exploring like, okay, I have this name for it now what? I stopped being ashamed. I think after I had a name for it is really when I started being able to understand it as a disease. And um, I think that it took some real love and compassion from people in my life who I'm so grateful for, in my family and in my friends, who normalized when I did talk about it and made it such not a it's not a big deal, that I was able to, just keep opening up and keep opening up. The same with people that I dated and sexual partners, as once we had that conversation and um even even later I was just like, you know what, if they're going to ask, they can ask me. I'm not going to start this whole experience with me giving them all of these like who else starts a date with giving their medical history? So it just allowed me to just give myself permission to be a person and not the symptoms that I was experiencing. Um, I think I think HS is a very deep part of my identity now that I have a name for it too. I can advocate for the disease and people, like I've had people in my community send me a text and say, "Hey, I think my friend might have HS. Can you talk to them, and see what's going on?" And yes, I've talked with dermatologists and other doctors in this area about support groups and because so many of us just rely on each other through the online community, which is beautiful, but I've only ever met maybe one or two other people in real life that have HS. And so I don't know, the more we talk about it, the more we can see each other and support each other. And that's important to me. I'm an activist in many areas of my life. And why not be an activist for this disease and, show people that we're capable of so much more than our diagnosis and our symptoms. It's constantly changing. We still haven't gotten to a point, it's something that is very difficult to get into remission. Very few patients achieve remission. And so yeah, it's about managing the symptoms, and um for me that's looked a variety of different ways. So it's looked like wound care, and that has been a journey. So band-aids with 2x2s stuck under them, and tape, all the different types of tape, trying to figure out which ones were not going to rip my skin in these very sensitive areas. Um, what can I put on a flare site in terms of keeping it clean and helping with regenerative um, skin in that area. So, the creams and the sprays and all that. um, so one of the products that I've had a lot of success with in wound care management is the pain relieving antiseptic spray. I have to look at it every time. It has lidocaine in it, and so you can spray on an abscess as it's building that pressure and gets painful, but you can also utilize this spray on an open flare. And so this is something that you can get at a CVS or Walgreens, any pharmacy in the United States anyway. And yeah, it's a great piece to my wound care puzzle. When I'm in a pinch, I like to use the silicone tape that is easier to peel off of my skin. It's not as harsh to rip off. But what my preferred option right now is actually HidraWear shorts. I really love the HidraWear shorts. I love the adhesive free bandage. It really does work best for my skin. And yeah, I'm very lucky to only have like one problem area right now. So that piece of equipment is really perfect for me in my wound care right now. In terms of other management of my symptoms, for my mental health, I do a variety of holistic things. I do sound baths, which are also anti-inflammatory. I do massage, and I also take some medications for my mental health diagnoses. And then for my HS management, I use metformin, which is generally a diabetes drug, spironolactone, which is an acne medication, and I'm taking fish oil for inflammation, a very high dosage of fish oil. I'm also eating an anti-inflammatory diet, very few processed foods, lots of fruits and vegetables and plant-based foods. I'm having great success with the anti-inflammatory diet, actually. I've noticed changes even in like tingling in my fingers. So I can really feel a change in the inflammatory system. And then I also do a Remicade infusion, where I think I'm taking 1,400 milligram infusion every 6 weeks. I also have a lot of social support. So because I'm so open with my diagnosis, um, my friends are, very supportive and able to assist me when I'm having trouble walking and having those difficult days where it's just hard to be in my body. I have an incredible husband who helps with my bandaging and helps with running me baths, very warm, hot baths help a lot. So he's just my biggest champion, and those people that I've met online. Shout out to Lauren and Selena, who absolutely changed my life by making me feel so understood and just making me feel seen and giving them an opportunity to feel seen too. So those have all been instrumental in my process.
It's actually kind of fascinating to hear just how much you've had to change, and like all the tools that you've kind of like assembled, whether the tools are people or uh, baths or medication or band-aid, like, yeah, um there's a lot there for your day to day. Okay.
Absolutely.
There's a lot. A shout out to you for coping with all that. um would you recommend to people who have symptoms, so maybe someone's experiencing a recurring lump, a recurring well, we call them boils, even though technically they're not boils. So any kind of HSE symptoms, would you recommend they um, get a diagnosis?
Yes, absolutely. It's not an easy process. You will have to bring your patients. You'll get people in the health professions who are unfamiliar with your disease, and you may have to try and try again and try again until you can be heard. Um, I would encourage someone who's experiencing symptoms to maybe seek out the HS community and talk to us about maybe questions that you have, or even there's great websites that are available where you can learn more about HS so that you can be empowered to talk about it when you go into your appointments. Um, it can be a very difficult thing to talk about depending on where you're experiencing flares. And so, it may also be helpful to have a friend that you trust and talk to them about what you're experiencing so that they can help support you through the hard the hard medical stuff that's coming your way. It's just so hard to do this alone, and I think it's just better for your physical and mental health if you have the support before you start your medical journey. Hmm. I would say if you're like me and the second you find new knowledge, you start Googling things and trying to find the answers to all your questions and problems. I would say don't try everything all at once. Um, you're it's going to be a process to see what works for your disease state. And so what works for me in terms of my mental health care and physical health care, and the medications that I take, things like that may not are not going to work for every HS patient. And so you have to be um, patient and see what the one thing that you've tried does before you can either count it out and move on to try something else or recognize that it's making a difference. I think also being patient when you do see results and then your body adjusts to those and they don't work anymore. um, so it's just a constant cyclical thing. Um, and you'll want to do everything that you can to stop that cycle. And it feels really tempting to be like, I'm going to change my diet and I'm going to, take all of these medications and, and. But I would say start small, make changes, in a reasonable pace to see what works for you.
That is perfect.
I think just re-emphasizing, yes, I have a disability, but it's disabled looks many different ways. And for folks to be open-minded about what that means, and to be um, vulnerable with themselves to accept what that means and then accept the resources that come along with that. So there are things that can assist you on your journey once you receive that diagnosis. And it's not such a daunting thing. It doesn't have to be. It can actually be an opportunity for you to live a more honest and open life. So I just really encourage people to challenge themselves to embrace it as part of their identity and not be ashamed of it.